Hello friends, I am Dr. Avi Kumar, Senior Consultant at Fortis Escorts, Okhla. Today I would be discussing you about pulmonary edema. As you know, the pulmonary edema is known as fluids in the lungs, and lung is a very important part of our body system. The main function of the lungs is to extract oxygen from the air outside and provide oxygen to the other parts of the body. It helps in increasing the oxygen levels of the body. And whenever there is fluid in the lungs, the in and out of the oxygen decreases, the diffusion of oxygen decreases, and it causes respiratory failure. So basically, pulmonary edema is fluid in the lungs, in the alveoli, in the air sacs. The fluid gets accumulated, the lungs do not participate in the diffusion of oxygen and carbon dioxide, and thus it causes respiratory failure. It causes decrease in the oxygenations. The patient feels breathless. So there are many causes of pulmonary edema. One, the main causes can be cardiac, the other causes can be non-cardiac. The cardiac causes includes coronary artery disease, the valve problems, the patients having severe aortic stenosis or patients having severe mitral stenosis or mitral regurgitations causes accumulation of fluid in the lungs. Then there is a hypertensive failure which also causes accumulation of fluid in the lungs, and there is chronic kidney disease which can lead to pulmonary edema. Among the non-cardiogenic pulmonary edema, the most common causes of non-cardiogenic pulmonary edema includes pneumonitis. Then it can be a trauma to the chest wall or inhalation of the toxins or poisonous gases, which causes pneumonitis to the lungs. And then there is high altitude pulmonary edema. Whenever we go to high altitude, the lungs gets accumulated with fluid. So, what are the symptoms of pulmonary edema that we generally see in the patients? The most and the first symptom that generally we see in patients with pulmonary edema includes breathlessness. The breathlessness is quite severe. It is mainly on lying down, which we term in medically term as orthopnea. Then the patient coughs. Initially, it starts with a dry cough, and then slowly and steadily it rises to have pink frothy cough. Then the patient is restless, the patient is anxious, the patient has tachycardia, the patient is tachypneic, then there can be decrease in the oxygenations, then can be blue nails, patient goes into respiratory failure. So these are the acute symptoms that we generally see in patients with pulmonary edema. What are the chronic symptoms? The chronic symptoms is breathlessness on exertion, more on lying down, dry cough, and then there is weight gain, then there is fluid pedal edema, that is swelling of the legs. So these, the patient remains anxious, restless. So these are the chronic symptoms that we generally encounter in patients with pulmonary edema. So how can we tackle it? So how we can treat it? So the most important part of pulmonary edema treatment is to provide oxygen to the patients in whom the oxygen is dipping, the patient is feeling breathless. You provide oxygen, maintain their saturations above 90%. If the respiratory rate is too high, the patient is using their respiratory muscles at a very high rate, provide them support with non-invasive ventilation if the patient is in ICU or in a hospital setup. Then the next point is to diuresis it. The excess fluid should be removed from the lungs. It occurs through diuresis. Aggressive diuresis should be taken place so that the excess fluid gets washed through the urine. Next is the morphine. Generally, morphine, it helps in reducing the anxiety levels. It helps in very helpful in cardiogenic pulmonary edemas. Then generally we provide support to the patients. Support can be, if the patient has high heart rate, we have to control the heart rate. If the patient has high blood pressures, we have to control the blood pressures, make the patients hemodynamically stable. Next If the patient has a high altitude pulmonary edema, the patient should descend as quickly as possible. Do not exercise um, in at higher altitudes. The patient should be given either diuretics or steroids if the patient is suffering from pulmonary edema. So these are the measures that we generally do, and these are the symptoms that we generally encounter in patients with pulmonary edema. As such, patients with pulmonary edema, they are an acute emergency, should be treated acutely at good hospital care, given good hospital care, and they respond to the treatment very well. With this, I like to finish my topic on pulmonary edema. Thank you.